Assalamualaikum. We are from Group 10 and will present our topic about Artificial Intelligence in Healthcare. My name is Muhammad Haziq Haikal bin Muhammadin Ali Sulu and my matrix number is 060622. So, this is my group member.
My name is Muhammad Afham bin Abdul Halim. My matric number is 060628.
Hi, my name is Muhammad Daniel Hakim bin Abdullah and my matrix number is 060617.
Hello and hi, my name is Muhammad Nazir Amin bin Abdullah 060620.
My name is Muhammad Hafizul Khairi bin Nazri and my matrix number is 060643.
The definition of artificial intelligence is intelligence that have been processed by a machine to help humans to achieve their goal. Some people describe it as a machine that follows the human function, such as a human mind, like learning, thinking and making decisions or action to solve a human problem. This AI have been proved to be successful for helping to solve many challenging problems in organization and industry. AI also used in healthcare. AI have been used into daily medical practice and have been made numerous progression in medical process, education and other. AI in healthcare can help the doctor, nurse and other in their daily life. It also can boost quality of life, make more accurate statement or diagnose precious treatment plans and also can help to lead the patient into a great outcome. AI also can track disease and with analyze data from other sources such as government and healthcare. As a consequence, AI can become a tool on our global public health for combating epidemic and pandemics such as COVID-19 right now. So, for the problem statement, as we know, AI can help humans in healthcare such as treat their problem or ill to lead the patient into a great outcome. The first problem is to use AI, we need a lot of data first to make the AI to predict a correct decision and a most suitable solution for the problem. The source of the data will involve with the patient that have issue to use in the AI system. The second problem is patient does not trust the data to use for the AI because the data is private and can be leaked by the unresponsible person. This problem has been the most discussed topic in AI in healthcare. The people that think AI is dangerous because AI not always incorrect and accurate. People scare if it can hurt them, such as the medicine that recommended by the AI is not correct and can make the patient overdose with the medicine given. This shows that trust is important in using AI in healthcare.
The main and first challenge of AI in healthcare is ethical challenges. The use of AI in the clinical practice of healthcare has huge potential to transform it for the better, but it also raises ethical challenges.
I will talk about legal challenge in AI. Many of the ethical challenges that have been discussed have solution or legal implication. Next, there are also several challenges that can be linked more directly to the legal system.
Security. What is security? Security is the most significant issue in the application of artificial intelligence to the medical profession, and it also necessitates the most thorough evaluation.
Okay, first one under the ethical is safety and transparency. Safety is one of the biggest challenges for AI in healthcare. The first challenge of safety is the use datasets need to be reliable and valid. The better the training data is, the better the AI will perform. The algorithms often need further refinement to generate accurate results. The second challenge is that the service of safety and patient confidence, some amount of transparency must be ensured. While in an ideal world, all data and the algorithms would be open for the public to examine. There may be some legitimate issues relating to protecting investment or intellectual property and also not increasing cyber security risk. Governmental or third-party auditing may represent a possible solution. Furthermore, AI developers should be sufficiently transparent. For example, about the kind of data used and any shortcomings of software. Second is algorithmic fairness and biases. Algorithms can exhibit biases that can result in injustice with regard to ethnic origins and skin color or gender. Biases can also occur regarding other features such as age and disabilities. In health sector, where phenotype and sometimes genotype related information are involved, biased AI could cause some issues such as lead to false diagnosis and render treatments ineffective for some subpopulations and thus compromising their safety. The third one is data privacy. Personal information in radiology comprises mainly images, analogous to photos taken by cameras such as X-ray, ultrasound, and computed tomography. This data is highly personal and sensitive. Widespread data use of AI training raises obvious concerns about data privacy, balancing on the one hand beneficence and justice. Harm from data privacy breaches can be consequential where a patient demonstrably suffers from discrimination, humiliation, or increased cost of insurance, or the harm can be deontological. Even if that particular patient did not suffer a negative consequence, the privacy breach still violates the duty owed by healthcare provider to the patient.
Firstly, the challenge that we will face under legal challenge is safety and effectiveness. The most important thing in artificial intelligence AI is being safe and effective. Stakeholders can contribute to the more success of AI implementation in clinical practice by ensuring reliable and valid data set, performing software update at regular interval, and being transparent about their product, including shortcomings such as biased data. AI process often require a large amount of data. Alternatively, consent from the patient may be required prior to data disclosure via AI. The second challenge is liability issue. Implementing AI in healthcare can have serious legal consequences if appropriate precautions are not taken. When a diagnosis or treatment is used based on an AI model and this results in a misdiagnosis or wrong diagnosis, we may wonder which entity is responsible. It is a hospital, a health professional, or an algorithm manufacturer. Humans are prone to mistake and error, as are the machines that we have. For this reason, a high degree of transparency among those responsible need to be enforced. Only then can we have more trust in this technology. Next one is cybersecurity. Cybersecurity is another important issue we need to consider when addressing legal challenge to the use of AI in healthcare. In the future, most healthcare-related service processes and products will operate in the IoT. Unfortunately, most basic infrastructure is vulnerable to cyber and physical threats and dangers. For example, hackers, cybercriminals, and sophisticated state can exploit vulnerabilities to steal or influence the flow of money or important healthcare-related information. In addition, corrupted data or infected algorithms can lead to inaccurate and unsafe treatment recommendation. Cybercriminals can gain access to sensitive data such as patient health information or can threat patient safety by abusing their health, in particular AI. which can be vulnerable to manipulation.
The first part of security challenge is hardware security. Nowadays, there's a lot of manufacture of gadgets that are used to improve human existence, such as health scanners. However, most devices are not long-lasting and cause people to ignore their level of fitness. Purchasing new technologies is equally harmful to humans. The majority of AI utilized by humans lacks perfect security. This might result in data leakage, and the data will be used in the interest of irresponsible parties. Second, software security of the AI system. The majority of AI utilized by humans is old AI. This causes information to be received incorrectly since it is out of sync with what is available today. Different patterns each time an AI study is conducted might result in the interchange of various outcomes, such as inaccuracies in the data acquired. This can be harmful to the patient undergoing testing. Next is human factor in handling the security. If a doctor or engineer handles AI but lacks the necessary expertise, it might negatively influence AI. If the problem is not addressed promptly, it will continue to occur. This is due to a lack of adequate and high-intensity training, which causes them to be less proficient in handling AI despite having attended specialized training in the usage of AI. Finally, protection of human genetic resource. The usage of weapons in modern times is no longer or less significant. As a result, they developed bioweapons that were more effective at assaulting opponents. This weapon might endanger human survival merely by utilizing the genetic knowledge gained by AI after researching human biology. Many countries employ this approach to manufacture these weapons.
Next is solution for ethical challenges. There are several principles for ethics of AI in healthcare. The first one is protect autonomy. Humans should have oversight of and the final say on all health decisions. Next principle is promote human safety. Developers should continuously monitor any AI tools to make sure they are working as they're supposed to and not causing harm. The third and the last one is ensure equity. Developers must make sure tools are available in multiple languages, that they are trained on diverse sets of data.
Now, I will talk about the solution for legal issue in AI. The first one, develop the new or current medical device and system. Use the latest version or software to make sure the system will not bring any problem or can reduce error and mistake by the system. Second, conducting regular assessment into the representative of data set and whether they are affected by bias element. To solve this issue, a complete set of data and information must be put in AI to avoid unfairness, bias, and discrimination to the unlucky person. The third one, using various strategy and tools to solve cybersecurity issue. All parties involved in AI need to keep the data and information in a safe place. They need to put the data and information in good protection recovery mechanism and always upgrade the software to use the latest version.
How can we overcome this issue of controlling this AI? There are several approaches of dealing with this issue. First, produce gadgets with items made of high-quality materials that are not readily harmed by the environment. Install the most recent health-related programs and features, such as applications that measure heartbeats and identify disorders in the body. Next, inspect and investigate the AI before and after usage to guarantee that no damage happens while it is processing data. If damage happens, continue to haste to make repairs so that the AI is not harmed further. Finally, develop legislation governing the production of medication based on knowledge gathered by AI This assures that no country unilaterally use such information for nefarious reasons.
Artificial intelligence also contributes in healthcare. For instance, AI has contributed in diagnostic accuracy and also help in the analyze data of health by comparing a lot of medical records, experiencing automated learning with clinical alerts, efficient in health service and others. With the contribute, it can make the AI get more training and learning to shape their decision making for patient health. Furthermore, AI also increase the ability of doctors to understand the pattern and needs of their patient, so they are able to provide necessary feedback, guide and support their patient for staying healthy. The last one, AI also can decrease some costs to make a medicine. AI has been used to predict from the data structure with medicine effective or not effective against various ill or disease.
In conclusion, medical image analysis software based on artificial intelligence (AI) is becoming more common. The use of AI technology to automate process in the diagnosis and treatment of patients in need to care is now AI in the medical. To get the most out of AI, we need to identify the problem, investigate and analyze its impact, and come out with a comprehensive solution. Firstly, security is one of the most pressing concerns in AI. In the most critical challenge in the application of AI to the medical industry is security, which also necessitates in the most thorough assessment. The topic of the hardware and software security will be discussed in this article. Firstly, security is one of the most pressing concerns in AI. The most critical challenge in the application of AI is to the medical industry is security, which also necessitates in the most thorough assessment. The topic of hardware and software security has been discussed in this article. Second, there are ethical issues to consider. Given the AI technology has the great ability to jeopardize the priorities, safety and privacy of patients, this powerful technology poses a new set of ethical challenges that must be identified and managed. Current AI policy and ethical principles, on the other hand, lag behind the achievement AI has achieved in the healthcare area. Lastly, the problem and legal issue we highlight are four major ethical issues that must be solved in order to fulfill AI potential in the healthcare. To begin, obtain information of consent to use. Second, there are the issue of security and openness. The third point to consider is agrammatic, fairness and bias. Finally, there are data security to guarantee that AI is successfully adopted in ethical and valid manner. Okay, that's from us. Thank you.